You've heard us mention it several times at this point. November is Lung Cancer Awareness Month, and the Nebraska Cancer Coalition, in partnership with Dr. Joel Michalski, an oncologist with Nebraska Cancer Specialists, they are working to increase awareness of the importance of lung cancer screening. Lung cancer screening is the way to find cancer early and to ultimately save lives. Dr. Michalski, we appreciate you joining us today. What is a screening test and what's available for lung cancer?
Yeah, screening tests are something that most healthcare providers are very familiar with, but folks out in the usual circumstances as they're taking care of their day-to-day activities may not know much about a screening test. So what a screening test is it's a powerful tool that we hope to utilize in an effort to try and capture a disease, and this could be cancer, it could be heart disease, it could be really any sort of medical affliction. That we're trying to capture that disease very, very early on, perhaps before there are any symptoms or signs associated with it, with the overarching goal of really trying to prevent problems and ensure an opportunity to try and attain a cure or capture a disease to where you can manage it before it causes a life-threatening issue.
On one of our recent videos, we had a chance to hear from a lung cancer survivor as he shared his testimony, encouraging people to get screened for lung cancer. I want to give you an opportunity to share with us why you think it's important for Nebraskans to prioritize this and do get screened. Your thoughts?
Yeah, you bet. There's kind of probably a two or a threefold part to answer that question. So first and foremost, lung cancer is a disease that is often captured late in the stage. So we do know that your chances at survival are dramatically increased if you capture the disease at an early stage. And a screening test is probably the best tool to obtain that type of outcome because honestly, in early stages, people are not often going to have any symptoms related to their lung cancer. Oftentimes, if it's an early stage lung cancer that's being diagnosed, it's because somebody had a scan for another indication and we stumble across it. So utilizing that opportunity to try and capture a disease process early on is very important. Second of all, lung cancer is not only a worldwide and nationwide problem, it's a local problem too. 1,500 Nebraskans are estimated to be diagnosed with lung cancer. A fair proportion of those folks are going to be late stage. Approximately half of those patients are thought to die from lung cancer each year as well. So it's an important problem. We're working hard to improve our ability to treat the disease when it's captured, especially when it's late in the disease course, and we're making just phenomenal headwinds into that. But the big issue is where we're going to really make some big impacts is trying to capture that at a very early stage.
Well, it is some great news sharing. You're making some progress on that front. Just kind of we round out our conversation today. What are some of the risk factors for lung cancer people should be aware of?
You bet. So the number one risk factor is cigarette smoking. That's associated with somewhere between 85 and 90% of all lung cancer cases. And so, identifying those patients that are smokers and, first and foremost, working hard to try and get them to get quit, which is, I know, one of the most difficult things for any individual to try and succeed with. But working hard at that will help hopefully prevent cancers. Getting those folks that are high risk for lung cancer into a screening program, which is something that all health systems and Nebraska Cancer Specialists find very important and have all created very effective lung cancer screening programs that can help identify patients and follow them through their screening journey. Those are all just very, very important aspects of how we're going to be able to tackle this. But the cigarette smoking aspect of it is huge. Both if you're a cigarette smoker or if you're exposed to secondhand smoke. The next other strong risk factor that's associated with us being here in the Midwest is radon exposure. I don't have Nebraska statistics, but probably around 20,000 cases in the United States are probably associated to radon exposure. We just don't know enough about that risk factor to really identify those folks and enroll them into specific screening programs, unfortunately. But again, as prevention is important, as you're moving into a new home, making sure that home has been checked for radon, and get that exposure mitigated if it's at higher dangerous levels. So, then outside of those two things, which are largely environmental, there are several other risk factors that we're still learning a lot more about as far as other exposures, and certain genetic risk factors and things like that. But by and far, in a way, cigarette smoking or cigarette smoke exposure is the number one risk factor.
Well, I did not know about the radon side of that, so I appreciate you sharing that as well as the other information you did here today, Dr. Michalski. We really appreciate your time. Thanks again.
You betcha. It's a great honor to speak about this important topic.